A coma is a state of prolonged unconsciousness, often resulting from severe injury or illness. Imagine a deep sleep where you can't be woken up no matter how hard someone tries. That's what it's like to be in a coma. It's as if the person is trapped in a deep, unending slumber. People in a coma don't respond to their surroundings. They remain unresponsive to external stimuli. They don't open their eyes, even when there's a loud noise or bright light. They don't react to sounds or touch, no matter how intense the stimulus might be. It's a very serious medical condition that requires immediate and intensive medical care. One of the hallmarks of a coma is the lack of a sleep-wake cycle, which is a critical indicator of brain function. Unlike a normal sleep state, a person in a coma doesn't experience periods of wakefulness or sleep. Their brain remains in a constant state of inactivity. Their brain activity is significantly reduced, resulting in this unresponsive state. This reduction in brain activity is what makes a coma so different from sleep. It's important to remember that a coma is not like being asleep. It's a much more profound state of unconsciousness. Understanding this distinction is crucial for the patient's family and friends. Families often face a challenging and emotional journey when a loved one is in a coma, hoping for signs of recovery. Medical professionals work tirelessly to monitor and treat the patient, aiming to bring them back to consciousness. While some patients do recover, the path to waking up can be long and uncertain. There are many reasons why someone might fall into a coma. One major cause is traumatic brain injury. This can happen from a car accident or a bad fall. When the brain is injured, it can affect its ability to function properly. Another common cause is a lack of oxygen to the brain. This can occur during a heart attack or stroke. Without a steady supply of oxygen, brain cells begin to die, leading to coma. Other factors like drug overdoses or severe infections can also disrupt brain function and result in a coma. Diagnosing a coma involves a series of steps. Doctors first examine the patient and review their medical history. They check for reflexes and responses to stimuli. Brain scans like CT scans and MRIs help visualize any damage or abnormalities. Treatment for coma focuses on addressing the underlying cause and providing supportive care. If a head injury is to blame, surgery might be necessary to relieve pressure on the brain. Medications can help manage seizures or swelling. Patients in a coma require constant monitoring and care to ensure their vital signs remain stable. Section 4. Prognosis and long-term outcomes. A spectrum of possibilities. The outlook for someone in a coma varies greatly depending on the severity of the brain injury and the underlying cause. Each case is unique, and the prognosis can range from full recovery to long-term disability or even death. Some individuals may gradually emerge from a coma with varying degrees of recovery. This process can be slow and requires extensive medical support and rehabilitation. They might experience physical, cognitive, or communication challenges. Physical therapy, occupational therapy, and speech therapy are often necessary to help regain lost functions and improve quality of life. In other cases, a coma might progress to a persistent vegetative state where there's minimal brain activity and no awareness of the surroundings. This state can last for months or even years, with little to no improvement. Sadly, some individuals never regain consciousness, and the coma can be fatal. Families often face difficult decisions regarding long-term care and life support. The duration of a coma is also a critical factor in determining the potential for recovery. The longer a person remains in a coma, the lower the chances of a full recovery. Time is a crucial element, and ongoing medical assessments are essential to understand the evolving condition of the patient. Section 5. Coma beyond medicine, a metaphor for societal apathy. The term coma is often used metaphorically to describe a state of unawareness or inaction, particularly in societal contexts. It paints a vivid picture of a collective numbness, a state where people are physically present but mentally and emotionally disengaged. For instance, we might say that society is in a coma when it comes to addressing climate change. Despite the overwhelming evidence and the dire warnings from scientists, there is a pervasive sense of inertia. People continue with their daily routines, often oblivious to the environmental catastrophes unfolding around them. This implies a lack of urgency or action despite the pressing nature of the issue. The ticking clock symbolizes the limited time we have to make meaningful changes, yet the collective response remains sluggish and indifferent. Similarly, political apathy or a lack of engagement in important social issues can be likened to a metaphorical coma. Voter turnout is often low, and many people feel disconnected from the political process, believing their voices do not matter. It suggests a disconnect between individuals and the world around them, a failure to recognize and respond to critical challenges. This disconnection is exacerbated by technology, which, while connecting us digitally, often isolates us physically and emotionally. In this sense, the term coma transcends its medical definition to encompass a broader societal meaning. It serves as a powerful metaphor for the widespread apathy and disengagement that plague modern society, urging us to wake up and take action before it is too late.